Well, the question of the effect that consolidation has on the delivery of care really depends upon what kind of consolidation you're talking about. We've got a couple of kind of different trends that I see in the environment. One is the tendency for hospitals to come together and merge and form much larger systems. And that obviously has pluses and minuses. In general, the hospitals feel that by coming together, they can have more market leverage by being a larger system that controls more care. They're in a better position to negotiate prices with payers. But the flip side of that is that if you look at it from the perspective of state attorneys general, they're really worried about consolidation creating monopolies or creating situations where a particular player becomes too powerful in the market and actually winds up driving prices up as opposed to driving prices down. So that's one form of consolidation. The other that I personally have more experience with is the consolidation that occurs when individual hospitals or health systems start buying up physician practices and employing the physicians, saying, okay, we're now an integrated delivery system because we not only provide hospital care, we also provide ambulatory physician services. That's a whole different kettle of fish, and I think you have to look at those two kinds of consolidation separately because the impacts are very different on the people within the system. It's interesting to me that I think a lot of these deals, everybody knows we live in a very faddish industry. Yeah. You know, it's the fad of the day, everybody jumps on board. Well, consolidation is, in my view, the in fad right now. And I think a lot of governing bodies aren't asking the questions they need to ask at the front end. Why are we considering merging with XYZ health system? Why are we considering this acquisition? And if you can't answer that question very clearly with good data to back it up, then maybe you should just back off a little bit and see where you go from there. The other thing I note is that everybody who's done this says, well, I want to be like Geisinger or Mayo or Kaiser, and they hold up those models of the physician, hospital, insurance plan, integrated entity. But they forget that Susan was talking about 7 years. Well, that's on the short end. Right. Those organizations have been around for 50, 100 years, and they didn't get to where they are in 7 years or 3 years. So people need to understand when you go into this, you're talking about a long-term change. It's going to be painful. It's going to be difficult. It's going to be expensive. You might save money downstream, but you're going to have a lot of new costs on the front end. So I just feel like as an industry, we're somewhat naive about this. The other thing that I think enters into this is that we are seeing a real transformation in what healthcare organizations are expected to do. And for example, hospitals used to survive primarily on high-value, expensive inpatient care. The pendulum has swung way to the other side where the ambulatory care side is a bigger revenue generator for a lot of these organizations. David and I have worked with a small hospital where they acquired almost all the physician practices in the community. The physicians feel like the hospital management team still thinks they're running a hospital rather than running an ambulatory care organization. And in talking with the CEO, they're making more money off of the physician practices than they are off of the inpatient care now. The physician practices have been the biggest driver of their revenue stream. As a consultant, I feel like often we get called when they haven't done that planning in advance. And we're part of the cleanup crew to try to help them figure out, okay, now what do we do? How do we move this forward? But it's just, if you got two hospitals that merge and both of them offered OBGYN services, I will venture that every OBGYN nurse is asking the question, are they going to consolidate the service into one facility? Is my job at risk? And it's really hard to get people motivated to help with the merger when they're worried about whether they're going to have a job tomorrow or not. On the physician side, I've seen situations where I sometimes can't believe this happens, but hospital acquires the practices of a bunch of physicians. Before the acquisition, let's say it's a 4 or 5 physician practice, those physicians used to be the owners and managers of their practice. Now they are out of the loop because they are being managed by staff, practice managers who don't report to the physicians, they report to the hospital administration. I hear complaints from physicians like, I get a really good person working in my practice, and then the hospital transfers them to another practice because they're really good,
Right.
and I'm left trying to train somebody new. And the HR people can't find me a replacement because it's a tight job market. It's hard to find people with the right skills. And even worse, I've had, you probably know the place, I've had situations where HR has said the physicians cannot be involved in making personnel evaluations and decisions about the people in their practice because it would violate the confidentiality. That it's the manager who is responsible for those people who worked with HR. And I've had docs come to me and say, I went in and found out that one of my nurses is no longer employed there, and no one even asked me what I thought about that. And if you want to find a way to undermine physician confidence in that consolidation, boy, that goes a long way.